Thanks again for that lively presentation and discussion. We'll turn now to Rod Pettigrew and from National Institute of Biomedical Imaging and Bioengineering, and Kevin Patrick from UCSD, who will talk about their group discussion on mobile health technologies.
Thank you, Rick. And the name of our institute is indeed a mouthful, even for me after 12 years of saying it. I am the director of NIBIB, and I had the pleasure of co-chairing this working group with Kevin Patrick. However, I was on leave for all of the discussions. So Kevin will actually make the presentation, but I do have an opportunity to introduce the working group, which brings a rather remarkable array of experiences and areas of expertise to this discussion. So I do want to say a brief word about each of them. And I had planned to make a couple of introductory remarks, which actually have already been made by Francis in his a beautiful overview of this initiative. The members, as you see there, are Rick Knesson, who comes to us from Intel, where he has a digital health group. Bill Heat-Dirks is from my institute, NIBIB, and I want to give him a shout out because he stood in for me when I was on leave. Thank you, Bill. Santosh Kumar has a distinction of having received one of the first awards from NIH under the Big Data to Knowledge initiative. His Center of Excellence Award actually focuses on mobile data to knowledge, and he's at the University of Memphis. Wendy Nielsen and Bill Riley are from the NIH. They're in the Office of Behavioral and Social Sciences Research. And Peter Tippett is from Verizon, where he is a chief medical officer. And he tells me that this is the fastest growing sector of the Verizon business. Eric Topol, known to many of us, a renowned cardiologist, prolific author of The Creative Destruction of Medicine that focuses on the digital health revolution, is the only member of the working group who is not able to be here today. Kevin Volpe comes from Penn and the Wharton Business School, where he directs the Center for Health Incentives and Behavioral Economics. So you know who to direct your questions to. We have quite an interesting array of individuals here in areas of expertise represented. As I mentioned, the introductory comments I had planned to make, Francis has covered, but a couple of them I do want to underscore. And the first is that one obvious need has already been described to facilitate a cohort like this is the development of a modern communications IT infrastructure and system that is adaptable in order to be able to link the kinds of databases that we've been talking about, the electronic health records with the various omics database, and also the kinds of data that is emerging from the rapidly growing sector of biosensors, which can interface with smartphones and provide not only the kinds of data that we've talked about so far, but physiologic, environmental, and social data, and those sort of data points that impact and are determinants of health, and also modulate genetic expression. This is an active area of development, and as Mike Lauer pointed out, also represents a challenge because it is so rapidly changing. The other point that I would want to make here is that this is obviously critical to addressing some issues that have already been raised about engaging patients, allowing them to feel as though that they are driving research questions of interest to them. The system has to be developed in such a way as to facilitate that. And to provide ready feedback to the patient so that they do feel as though they are engaged and valuable and active participants and get something from them. So that leads to the final point that we'd like to make, is I think that one of the driving goals for this is the creation of a new public culture, a culture of motivated public participation in this kind of research. This is something we've all alluded to, but I think this platform that we're talking about, I think, will be critical to achieving that. The report will be given by my co-chair, Kevin Patrick, who is professor of preventive medicine at UCSD. He also directs the Center for Wireless and Population Health Systems at the Qualcomm Institute there at UCSD, and has the distinction of having been for 20 years editor of the American Journal of Preventive Medicine. Kevin.